Good afternoon, everyone. In the past 2 weeks, the numbers of cases of COVID 19 outside of China has increased 13-fold, and the numbers of affected countries has tripled. There are now more than 118,000 cases in 114 countries, and 4,291 people have lost their lives. In the days and weeks ahead, we expect to see the numbers of cases of the number of deaths and the number of affected countries climb even higher. The WHO has been assessing this outbreak around the clock, and we are deeply concerned by the alarming levels of spread and severity and by the alarming levels of infection. We have therefore made the assessment that COVID-19 can be characterized as a pandemic. Pandemic is a word to use lightly or carelessly. It is a word that, if misused, can cause fear, cause unreasonable fear or unjustified acceptance that the fight is over, leading to unnecessary suffering and death. Describing the situation as a pandemic doesn't change the WHO's assessment of the threat posed by the virus. It doesn't change what WHO is doing, and it doesn't change what countries should do. We have never before seen a pandemic sparked by a coronavirus. This is the first pandemic caused by a coronavirus, and we have never before seen a pandemic that can be controlled at the same time. WHO has been full response mode since we were notified of the first class. We have called every day for the countries to take urgent and aggressive actions. We have rung the alarm bells loud and clear, as I said on Monday. Just looking at the numbers of cases and the numbers of countries affected does not tell the full story. Of 118,000 cases reported globally in 114 countries, more than 90% of cases are in just 4 countries, and 2 of those is China and the Republic of Korea have significantly declining epidemic. 81 countries have not reported any cases, and 57 countries have reported 10 cases or less. We cannot say this loudly enough or clearly enough or often enough. All countries can still change the course of this pandemic. If countries detect, test, threat, isolate, trace, and mobilize their people in the response, those with a handful of cases can prevent those cases becoming clusters, and those clusters becoming community transmissions. Even those countries with community transmissions or large clusters can turn the tide on this virus. Several countries have demonstrated that this virus can be suppressed and controlled. The challenge for many countries who are now dealing with large clusters or community transmissions is not whether they can do the same. It's whenever they will. Some countries are struggling with the lack of capacity. Some countries are struggling with lack of resources. Some countries struggling with lack of resolve. We are grateful for the measures being taken in Iran, Italy, and the Republic of Korea to control their epidemics. We know that these measures are taking a heavy toll on societies and economics, just as they did in China. All countries must strike in a fair between protecting health, minimizing economic and social disruption, and respecting human rights. The WHO mandate is public health, but we're working with many partners across all sectors to mitigate the social and economic consequences of this pandemic. This is not just a public health crisis, it is a crisis that will touch every sector, so every sector and every individual must be involved in the fight. I have said from the beginning, countries must take a whole of government, whole of society approach built around a comprehensive strategy to prevent infections, save lives, and minimize impact. Let me summarize in 4 key areas. First, prepare and be ready. Second, detect, protect, and treat. Third, reduce transmission. Fourth, innovate and learn. I remind all countries that we are calling on you to activate and scale up your emergency response mechanisms Communicate with your people about the risk of how they can protect themselves. This is everybody's business. Find, isolate, test, and treat every cases and trace every contact. Ready your hospitals, protect and train your health workers. Let's all look out for each other because we need each other. There's been so much attention on one word. Let me give you some other words that matter much more and that are much more actionable. Prevention, preparedness, public health, political leadership, and most of all, people. We're in this together to do the right things with calm and protect the citizens of the West. It's a doable. I thank you.